today's lecture would be about the dental management of the surgical patient with cardiovascular disorder. This is the second part of our lectures. My name is Ahmed Al-Marashi. I hold an MSc degree in oral and maxillofacial surgery from Manchester, and also a lecturer at the University of Basra, College of Dentistry. In the first part of our lecture, we'll discuss about the dental management of patients with heart failure. So what is heart failure? Heart failure can be defined as insufficient contractile activity of the heart muscle. This can cause inadequate cardiac output. When there is an inadequate cardiac output, we will have hypoperfused organ and the fluid will accumulate throughout the body, like for example in the lung, liver, and also the peripheral tissues. We have different etiology that can cause heart failure. For example, a coronary artery disease, untreated hypertension, cardiomyopathies, rheumatic heart disease, a recurrent rheumatic heart disease, and also congenital heart malformation. There are certain agents that can also result in heart failure. The American College of Cardiology and the American Heart Association can classify the heart failure into different stages. We have patients that can be referred as compensated patients and also patients that refer to as decompensated patients. Compensated patients will usually have or at risk of heart failure without any signs and symptoms. These would include patients within the stage A, stage B, and part of patients with stage C. Decompensated patients, on the other hand, will have the signs and symptoms of the heart failure and a high risk for developing unwanted events during the dental procedure. These will fall within the category stage D and part of the patient with stage C. Now, patient with stage A usually at high risk for heart failure, but without the structural heart disease and without the symptoms also of the heart disease. These can include patients with coronary artery disease and hypertension. So the patient might have hypertension, but doesn't have the heart failure. So if the patient are at high risk without heart failure, then they are within the stage A. On the other hand, patient on stage B will have the structural heart disease, but are without the signs and symptoms of heart failure. For example, we have patients who are asymptomatic but have left ventricular hypertrophy. So patients have a left ventricular hypertrophy, have a structural heart disease, but there is no sign and symptoms of a heart failure. Or for example, patient with an impaired left ventricular function also have a structural heart disease but without sign and symptom of heart failure. Then this patient would fall within category B or stage B. In addition, we have patients who live to be on stage C. They have structural heart disease but might have current symptoms or had the symptoms in the past of a heart failure. On last part of the classification, patient with the stage D will have heart failure that requiring specialized intervention. So have the symptoms, current symptoms, and these would be difficult to be treated on medications. And as we said, who have marked symptoms at rest despite the maximum medical therapy. So they take the medication, but despite that, they still have the signs and symptoms of heart failure. So what are the general signs and symptoms of patient with heart failure? Patient will usually have dyspnea, even with the mild effort, fatigue, and also cough and dyspnea when the patients lie flat. This is mainly due to the redistribution of a fluid within the lung. Patient will also have abnormal swellings secondary to ascites, which is the accumulation of fluids in the peritoneal cavity. Patients with heart failure will also have pitting edema of the lower extremities. So the last three parts is mainly attributed to the accumulation of the fluid within either the lung or the peritoneal cavity or within the legs. This might give us cough and dyspnea when the patient lies flat, as the fluids will redistribute through the lungs, or swelling ascites due to the accumulation of fluid as well in the peritoneal cavity, or when there is accumulation of fluid within the legs, we have pitting edema. What can we see within the oral cavity will be manifested by the drugs used for patients with heart failure. If the patient happen to have angiotensin converting enzyme inhibitors in their medications, like captopril, then we can see lichenoid drug reaction, burning mouth sensation, and also a loss of taste sensation. If the patients have diuretics in their medications, for example furosemide, then xerostomia or dry mouth might develop. There are certain things need to be considered for patients with heart failure. First of all, we need to consult with the supervising physician. As we said, there are compensated and decompensated patients. Compensated patients are patients with stage A at a high risk, stage B have structural disease but without sign and symptom of heart failure, and some of stage C. These patients will be stable, well controlled under medication, and the symptoms are absent during the time they visit the dentist. On the other hand, a decompensated patients are usually patients with stage D who have a structural heart disease and have the signs and symptoms of heart failure, but also they are taking the medication but without any help to minimize the symptoms. And also some of patients with stage C. These are referred to as decompensated patients, and they have pulmonary edema, fatigue, and dyspnea. What can we do for patients with compensated heart failure is we can afford to give a short early appointments, and we need to minimize the anxiety and stress. The appointment should be no more than 30 minutes. The patient is best to keep in a semi-supine position. We keep the patient in a semi-supine position to avoid redistribution of the fluid to the lungs, which might result in dyspnea. So it's best to keep the patient in a semi-supine position. We need to avoid non-steroidal anti-inflammatory medications, as it can lead to sodium retention and then fluid retention. While patients with decompensated heart failure, if it is within stage C, then we should wait until the condition is stabilized. So we refer the patients back to their physician. The physician might consider changing the medication, increasing the dosage, or whatsoever he will do. And until the patient is stabilized, elective treatment then can be provided. If the patient have an emergency treatment, then it's best to be treated in hospital setting. Patients with stage D are best to avoid giving dental treatment. And we can only do a palliative treatment with analgesics and antibiotics. Some would suggest a 3-level gradual approach for their emergency treatment. So as we said, there is no elective treatment for stage D, but if we need an emergency treatment, then we can approach the patient cautiously by using 3 levels. The first level will include the home level and will include pre-medications given to the patients and anxiolytics like diazepam, oxazepam, and also diuretics. Then when the patients arrive to the reception, then ECG monitoring should be done, blood pressure taking, pulse rate, pulse oximeter, and we'd also need to establish a venous line. When the patient receives the dental treatment on the dental chair, we need to sit the patient in an upright position to prevent the fluid accumulation within the lung, and also we need to consider oxygen administration. The patient should be continuously monitored during the procedures. If we have an emergency development of an acute heart failure, this will be mainly resulted from the sudden transition of the fluid from the blood vessels into the lung, which will result in acute pulmonary edema and severe dyspnea. We will see the patients be panic, unable to talk, and have a protective cough. Cyanosis might be evident, and if untreated, the patient will die. If the patient develops an acute heart failure on dental procedure, we need to sit the patient upright position to relieve as much as we can from the edema, pulmonary edema. We need to consider administrating the oxygen as this rate, 15 liters per minute. We need to check the blood pressure. GTN might be helpful to be given for such patients, and also diuretics, furosemide, IV, also helpful. And we need also to consider referring the patient to hospital as fast as we can. This is what we have for the heart failure. The second part of our lecture would be about the cardiac arrhythmias. If we want to define cardiac arrhythmia, it would be described as an abnormality in the rate, regularity, and also the site of the origin of the cardiac impulse. Or sometimes when we have disturbance in the conduction of the impulse between the different parts of the heart. There are different causes for cardiac arrhythmias. We have, for example, cardiovascular disorders, pulmonary disorders, like for example embolism, hypoxia, chronic obstructive pulmonary disease. And also we have sometimes systemic disorders that might result in cardiac arrhythmias, like thyroid diseases. There are certain medication might have given a side effect which result in cardiac arrhythmia as well. For the dental consideration of patients with cardiac arrhythmia, there are major risk predictors for the patients with certain types of cardiac arrhythmia to develop cardiovascular incidents. And we have minor risk predictors. Patients with major risk predictors will have increased incidence to develop myocardial infarction, heart failure, and death. While patients with minor risk predictors are less likely to have these cardiovascular risks. In most instances, the major risk predictors, the difficult situations we encounter in the dental practice, will be related to arrhythmia that is related to the ventricles. So if the patients have, for example, a high-grade atrioventricular block or a symptomatic ventricular arrhythmias, or also a supraventricular arrhythmia but with uncontrolled ventricular rate. So in most instances, the ventricles rate is abnormal. These are considered as a major risk for dental interventions. The patients will be at high risk to develop myocardial infarction, at a high risk to develop heart failure and even death during the dental interventions. So those patients will be managed in a different way from patients with a minor risk predictors. Minor risk predictors are less likely to develop these incidents. So what can we do? For a patient with a minor predictors, then we can deliver an elective treatment with these precautions. We need to minimize the anxiety during the dental procedures as low as possible. This can be done by giving pre-medications by benzodiazepines, for example, diazepam, Valium can be given. We need good communications with our patients, and we kept our appointment as short as possible. We also need to avoid excessive amount of epinephrine during the procedure, and we should give no more than 3 cartridges of local anesthesia with vasoconstrictor. Some patients on certain types of arrhythmia might be on anticoagulant therapy, so we need to determine if our patient is on anticoagulant therapy. And if the patient is on anticoagulant therapy, like for example warfarin, which might be given to patients with atrial fibrillation, then we need to establish the INR to know if the patient is at high risk of bleeding, if you want to do an invasive treatment. We also need to determine if our patient is on digoxin and if there is any suspected side effect of this medication. The patients who are on digoxin might have certain interaction with medication we might given during the dental procedure, for example erythromycin, which might increase the digoxin absorption and also increase its toxicity. Patients with arrhythmia might have a pacemaker fitted. We also need to consider the type of the pacemaker and avoid anything that might interfere with the signal of this device. On the other hand, patients with a major risk predictors will need only to deliver an emergency treatment by using local anesthesia without vasoconstrictor. So no elective treatment should be offered to these patients, and we also need to avoid vasoconstrictor within the local anesthesia. If we have a patient, as we said, who have a pacemaker fitted, what can we do? How we can manage patients with a fitted pacemaker? We need to identify the type of the pacemaker. There are differences between the new devices of the pacemaker and the older models. The newer devices will have better shielding and less interference from the surrounding environments than the older device. There are certain devices that might interfere with the signal of the pacemaker, for example, an electrosurgical unit, electronic apex locator, that one we use in endodontic treatment, the ultrasonic scalers we use in the periodontal treatment, and sometimes even the ultrasonic cleaning bath we use in our sterilization rooms. Previously, antibiotics were used to be given for patients with pacemakers, but the current recommendation will advise against the use of antibiotic prophylaxis for patients with pacemakers. So there is no need to give antibiotic prophylaxis for patients with pacemakers. If we have a patient that develop cardiac arrhythmia in a dental office, in their emergency treatment, we need to consider stop the procedure immediately. So if the patient develop arrhythmia during the dental procedure, stop the procedure and consider giving an oxygen. We need to immediately check the blood pressure, pulse rate, and also the respiratory rate. If the patient develop a chest pain, then glycerate trinitrate sublingual tablet should be administered, given to relieve that pain. And we need to put the patient in Trendelenburg position, which is the supine position with their feet above the level of their head. This will increase the blood supply to the head. If the patient is hypotensive and tachycardic, then we can perform carotid massage. And finally, if the patient lost consciousness, we need to start CPR. Those patients also need to consider to be transferred to the hospital as fast as we can. This would be the end of the first part of our lecture for today. If you have any questions, just feel free to post them in the chat. I'll be more than happy to answer. Thank you.